A third of North Carolinians are obese, so that means 1 out of every 3 people in our state are at risk of having a shorter life and health complications. And joining me now to talk more about obesity is Dr. Jamie Stokes, a bariatric surgeon with Novant Health. Thank you so much for joining us. I appreciate it.
Thank you for having me.
Let's start first off with the term obesity. Some folks consider themselves overweight, and at what point do you really consider yourself obese?
The terms of obesity and overweight and normal weight really depend on a patient's BMI, and that's a measure of a patient's weight versus their height. And there's very strict criteria about who falls into what category. And you can certainly talk with your physician, your doctor about which category you're in, but with the BMI of 25 to 30, you're considered overweight. Anybody with a BMI over 30, you would be considered obese.
And why do you think that we've seen such an increase in obesity over the last few years?
It really is a multitude of factors. Like anything in medicine, many factors play a role. Genetics, lifestyle choices, diet choices, lack or ability to exercise, other comorbid conditions such as heart disease or joint problems and pains, limiting a patient's physical activity. But lots and lots of factors really play a role.
And we know lots of folks, they will try to diet, they will try to exercise, all of those kinds of things. But for those who struggle with it, they might turn to a form of a bariatric surgery.
That's right. And not only bariatric surgery, but also weight loss medications. So with our program, we have a multitude of options available for patients, both surgical and non-surgical, to really help push them down the hill figuratively, to help get some of the weight off initially, to alleviate some of their joint and musculoskeletal pains, to allow them easier access to do the physical activities that not only do they need to do, but they want to do.
So you kind of tailor it according to, what somebody who comes in to see you, kind of what they need, what fits best in their lifestyle.
That's exactly right. We treat each patient as an individual and look at their situation, their comorbid conditions, their health history, what they're able to do, and their BMI, and try to really tailor an approach to them, whether it be a non-surgical approach or some of the surgeries that we offer.
Now, is surgery sort of the last approach to that, or does it, I mean, I know you said it does really matter, but is that sort of a last resort? Absolutely.
We want patients to have tried the other options first. So diet and exercise are usually the first go-to for any patient. Maybe they've explored some of the weight loss medications. There's a whole host of new medications on the market that have really gained some popularity. And if those have either not given them success they needed or they weren't able to tolerate them, then surgery really is the final approach or the final option for them.
And although it might be a last resort, it is not the last step. You have to continue with exercise, and the surgery shouldn't be sort of the end of it.
That's right. The phrase I use with my patients is surgery is a tool. It's just like going to any of the big box stores and buying a tool and coming home and learning how to use it and then using your tool appropriately, not only for your safety, but for your success.
All right. Well, great. Thank you. Some great tips there. I appreciate all that information. Thanks for coming in.
Thank you for having me.